What are dog vaccinations, and why do our best friends need them? Dr. Werber is here with the answers. I'm Molly, and this is Care Experts. Today we are talking about dog and puppy vaccinations with Dr. Jeff Werber, a practicing veterinarian for over 40 years. Dr. Werber, thank you for being here.
Thanks for having me.
So let's get right into it. What are dog vaccinations?
So vaccinations for dog or people, they're all the same. Basically, they are stimulators of the immune response, of the immune system. In dogs, for example, we have some that are we call attenuated or live vaccines. Those are made from the real disease that have been then passed on to different species. So they are no longer infective to the dog, but will stimulate the same immune response to protect the dog to develop its own antibodies against that particular disease.
Wow. Okay, incredible. And now what are the core puppy vaccinations? I know we all have to take our cute little puppy in to get vaccinated. Which ones do they absolutely need to have?
So that really depends on two factors. Number one, location, where you live, and lifestyle. So for your standard dog in Los Angeles, for example, the dogs that I treat, I'd say the core vaccines are your distemper parvo combination. That's the DA2PP. You have bordatella, and you have rabies. But now, because of a new disease that we're seeing a lot of, the influenza, a lot of locations that you might want to take your dog are requiring influenza. So in a sense, that might be becoming one of the core vaccines.
So can we just walk through those core vaccines? What is distemper?
So distemper is an epitheliotrophic virus, and that means it attacks epithelium surfaces, which could be the brain, respiratory, GI, so it's multi-systemic, and it potentially is deadly. So it's very important that dogs be protected.
So what is the rabies vaccine?
So rabies is also a deadly disease. It's a neurotrophic. It causes neurologic disease. It's a zoonotic disease, meaning that people can get rabies as well. So it's we have to be very careful when it comes to being bitten by rabid animals, dogs, wild animals that you might see in your neighborhood, skunks, raccoons. We all need to be careful because, again, rabies is a deadly disease, a deadly virus.
So let's talk about non-core vaccines. What is the Lyme's vaccine?
So Borrelia is an infection, a bacterial infection that causes Lyme disease, which is multi-systemic. Different people, different animals can have many different diseases or symptoms of Lyme. So if you live in an area where ticks are prevalent, mostly the Northeast, Lyme, Connecticut, for example, then it is essential that they should all have it. As I said, not core for me as far as my patients, but if I'm questioning a client, so what do you do for fun? Do you ever go hiking? Do you ever go in the canyons? Do you ever in the mountains? If they say yes, this time of year, I'm going to recommend the rattlesnake vaccine as well. It's not core, but that's definitely lifestyle.
And then what is the bordatella vaccine?
So we call it, the lay term, which I don't like using anymore, is kennel cough.
Yes.
Okay. Why don't I like using it? Because it's an airborne bacterium. And so you can have a dog that never steps foot or leg in a kennel,
right,
and still get bordatella. It could be an open window in the house and there's a dog running around outside. So I like to, now I've renamed it for myself to explain to clients. It's not kennel cough. It's live in LA cough. Go to the dog park cough. Go to the 3rd Street Promenade cough. Go to the Grove cough. I mean, it is everywhere. Go to the groomer cough. So if your dog is going to live and step foot outside, I recommend the bordatella vaccine. Now, as a vaccine, by the way, because it's a bacterin, it may not have the same lasting power as, say, a viral vaccine that is attenuated or modified live. So a lot of these facilities that require it will require 2 a year, every 6 months, not once a year.
That's right. Okay, so consult your vet.
Consult your vet.
All right, great. And what is the leptospirosis? Oh my gosh.
Leptospirosis.
Hello.
That's a tough one. So leptospirosis,
Yes.
that is also a bacterium.
Yes.
And that's the one that can cause severe kidney disease. In fact, we had an outbreak in Los Angeles a couple of years ago.
I remember this, yes.
And there were some wild rats that they feel at some of the parks in Santa Monica were shedding their urine, and dogs would have loved to pick it up, and what they do, they lick the urine on the grass. And we were seeing cases of lepto. Fortunately, that's subsided. I haven't seen a case in since then, actually.
Oh, good.
But I will question the pet parent. what do you do for fun? Do you go to, do you hike in the Santa Monica Canyons? Do you go out in the mountains? If they say yes, I would recommend lepto.
For those new pet parents who have just brought their new puppy home, what would a normal schedule for puppy vaccines look like?
The truth of the matter is, when a puppy is born under normal circumstances, let's not look at the abnormals. Normally, puppies nurse. In the first 24 to 36 hours of nursing, they get colostrum from the mom, which has all the antibodies they're going to need for at least 8 weeks, sometimes longer. It starts to wane a little bit, maybe 7 to 8 weeks.
Okay.
Now, what I see a lot of breeders doing, a lot of shelters doing, they're vaccinating puppies at 5 to 6 weeks of age. Okay, that is potentially dangerous. Why? Because again, let's think back. What is a vaccine? We talked about it. A vaccine is the antigen. It's the enemy. It's in an attenuated form, so it no longer can cause the disease. But mom's antibody, called passive antibody, because she gave them the antibody, they don't know that. They see this vaccine that you just gave it 5 weeks or 6 weeks. And they go, oh my God, it's a disease. And they go to attack it. And it's like the old Pac-Man game. You get one Pac-Man, and that's it, out of circulation. So when you give a vaccine too early, it uses up all of mom's passive immunity. Yet their own bodies aren't mature enough, their immune system, to start developing its own antibody. So now you're leaving the dog unprotected.
And we will be right back after this brief message from CareCredit.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back. Let's continue our discussion on dog and puppy vaccinations. So there are regional considerations for vaccines?
Absolutely. In fact, some states, rabies is required even at 12 weeks. You have to look at your state regulations.
So are there any seasonal considerations for vaccines, like every spring, anything like that?
Well, I mean, it really depends. If you are going to, again, enjoy more outdoor activities, depending on risk, then yes, you might want to only give the rattlesnake vaccine for spring and summer. The Lyme disease vaccine, again, since we don't see a lot of it here, again, I would consult your veterinarian if you're back east, an area where you see a lot of Lyme. Same thing with rattlesnakes. Just talk to your veterinarian about what would be required or necessary to protect your dogs in that location.
And I'm sure it varies based on, we're talking about different regions, different parts of the country, but what would you say is kind of a general cost estimate for vaccinating your dog?
Always a tough one. It could range. I mean, now with some of the newer vaccines like the influenza, leptospirosis, it could be, $40 to $50 a vaccine. The distemper parvos, maybe in the $30 to $40 range.
So, with all of these vaccines, I know there might be some patients who are hesitant to bring their dog in thinking, oh, this might cost too much. I'm not sure if I have the finances to do all this vaccinating. For those patients, do you have any financing options at your practice?
One of the things I recommend often is a third-party, payer. And then, for example, CareCredit. Clients seem to love it. I love it because when you're in business, and now the cost of just running an operation, a hospital, has gone up like insanely over the last several years, that we need to obviously cover the bills. So with CareCredit, obviously the client's able to pay for the services when rendered. And if there's any financing that needs to be done, CareCredit can provide that financing. So they're happy. We're happy because we get to treat the pet accordingly, appropriately.
Treated, yeah.
And then the owner has an opportunity now to pay it off slowly, and they work with CareCredit. So it's worked out great for us.
Wow, that's great. It sounds like the CareCredit credit card is a great option for pet parents.
Definitely.
All right, so you know what time it is.
Okay.
It's time for myth or fact.
Let's hear 'em.
All right, so first myth or fact. Dogs that don't go outside don't need vaccinations.
That is a myth. Many of these diseases that we worried about are airborne, and it's very possible even. So when you have, think of it this way. If you have a dog or a person that's exposed to something all the time, they have a natural immune system, a natural immunity. But if you have a dog, for example, or a cat that just just gets out and they have not had vaccines, they're like a sitting duck. So it would take less of whatever the antigen is to cause the disease.
Right.
So therefore, when it comes to animals, I think that vaccines should be done, core vaccines. The ones that they will not be subjected to or exposed to, I'm okay with not doing those. But you definitely want to have some protection.
Makes sense. All right, myth or fact, small dogs get smaller doses of vaccines.
One would think, obviously, that is a fact. It's a myth.
Really?
Yes.
Oh my gosh.
Because the immune system is such that it's not the size of the animal, it's the amount of antigen that animal can handle.
Oh, that's really interesting.
Yeah.
Okay, well, we have one more. Myth or fact, vaccines do not only help protect the dog that is vaccinated, but they also lower the chance of spreading disease to other animals.
That is true. That is a fact. Because what happens is when a dog gets a disease, they are shedding that disease. But if they're vaccinated and the antigen, the antibodies from the vaccine that they produced, okay, because remember, you give a vaccine, it's antigen, it's a disease attenuated. Now their body responds, makes antibody, kills off any disease that dog may be exposed to. Well, if they're exposed to and kill off the disease, they're not shedding live virus. Now, of course, there are some cases with parvo that there might be some viral shed, so that's not going to help. But overall, if they are protected and they're protected well, then they will be shedding less virus for the next pet.
Which is amazing, and we want to protect all pets.
Yes.
So thank you so much, Dr. Werber. We really
you.
appreciate your time.
Thanks for having me.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.
Through October 31st, 2023, earn an entry for your chance to win $5,000 in the Let's Get Digital sweepstakes. Enter the secret word PUPPY in the sweepstakes hub to earn one entry now. Head over to the sweepstakes hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. Legal residents of the 50 United States, D.C., and U.S. territories, 18 years of age or older, who have a CareCredit credit card as of 9/12/2023. Void where prohibited. Starts 9/13/2023, ends 10/31/2023. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank.